everyone. Myself, Dr. Manasi Patil from Kolhapur. I welcome you all on behalf of Ignited Minds by PHF to this wonderful series of learning Guruji ke Saath Guruvar 2.0 that we started on 10th of April 2025 under the mentorship of our Guruji, Dr. Liyakat Namole sir. So I think sir needs no introduction every time I say this, but still there are few things which we like to say about sir. So Dr. Liyakat Sir is most eminent and passionate homeopath from Nashik, Maharashtra. Sir has more than 31 years of experience and has conducted more than 500 seminars and webinars. Sir has conducted nationalized seminars on specific diseases like diabetes, cancer, infertility, skin, pediatric, etc. Sir's motto is to convert 10,000 GPs towards homeopathy. And till now, sir is successful in converting more than 2,000 GPs towards homeopathy. If not, they are practicing 100% homeopathy, but along with uh, homeopathy and general practice. Sir is pioneer of the group Ignited Minds by PHF, where more than 2,500 doctors learn on daily basis. He has discovered a unique method known as MML, that is Mind Method by Dr. Liaquat. The focus of MML is practicing solely on mind, and empathy is the mantra. Dr. Liyakat Namole sir is master of gestures. He is one who has introduced gestures into homeopathy. Through sir's keen observation and huge experience, he has found out many original gestures, which is the blessing to the world of homeopathy. And as we all know, Sir is author of a bestseller book, Humanopathy, that most of us have already read. 20,000 copies have already been sold, and Sir is working on the second edition. And today, as we all know, that we have completed two parts of the most important topic of organon, that is practical case taking. And today we are continuing this series with sir. So we are fortunate to have sir today with us. Thank you very much, sir. And over to you, sir. Welcome, sir.
Mute. Right. Yeah, this camera adjustment is. Yeah, thank you so much, Mansi. As always, your profuse introduction is always puts pressure on me to perform and to be able to give. I really doubt my abilities to be able to deliver uh, up to the expectations that you all have about me. Let's see. I try and give my
Hello.
best. Yeah.
Sorry to interrupt. थोडंसं पाठीमागे जातं का?
Parties out.
हां, हां, बस.
Okay. So I'll try and
हं.
give as much as possible that I learn. Okay. As always, I have always been doing that. I like to, tell everything that I know. Sometimes it can be correct. I don't know. You have to decide the accuracy of it. But I try to give all the honest things that I've learned in my practice. So let us. I've been fortunate actually that my teacher of organon is none other than my guru, Dr. Mutiara sir. He's a saintly, fatherly figure for me always. Always been a guiding uh, light for me. So organon was made interesting to us actually, though it's a very boring topic. Topic used to appear a very boring topic for now in our colleges, but it was made quite interesting by us. Dr. Effect Mutiara sir, the owner, founder, and principal of Mutiara Ayurvedic Medical College, Nasik, from where I have done my undergraduation. Okay, so let us go to the PPT. I have let me yes. It's raining. Okay, so last time we have learned till aphorism 93, the case taking part. Now let us discuss, let us study uh, the female case taking. That was the topic that was remaining. Okay, give me a moment, please. It's raining cats and dogs in Nashik. Lovely rain. Yeah. So, aphorism 94. While inquiring into the state of the chronic disease, the particular circumstance of the patient with regard to his ordinary occupation, his usual mode of living and diet. See, what does it say? What the doctor will say? Ordinary occupations, usual mode of living and diet. Usual mode of living and diet. Not when he's dieting or usual mode of diet, ordinary occupation. मतलब रोजमर्रा की जिंदगी में क्या करता है पेशेंट? His domestic situation में जानबूझकर इसको ये किया हो highlight. Domestic situation is where we call IPR, right, and so forth. Okay, must be well considered and scrutinized. Well considered and scrutinized to ascertain what there is in them that may tend to produce or to maintain disease, in order that by their removal, the recovery may be prompted. Okay, so obstacles to cures. And like I told before, if you remember my slide, I always said the aim of the case taking, you should uh, keep one thing in mind as to what makes the patient ill and what keeps the patient ill. What makes the patient sick and what keeps the patient sick. This is what Dr. Hanuman is saying here. Okay, so domestic situation. Okay, what does Dr. Hanuman say? Must be well considered and scrutinized to ascertain what there is in them that may tend to produce. Please remember, to produce. So again, IPR, again, psychosomatic diseases. You know? So what we take GNM, when we consider GNM, see how important it is now to understand the metaphysics of the situations or the IPR or the causations, so-called causations that we call. So the footnote says in chronic disease, this is talking about females, of females. See, in chronic disease of the females, it is especially necessary to pay attention to pregnancy, sterility, sexual desire, accouchements, miscarriages, sucklings, as like how she was when nursing the child, and the state of the menstrual discharge. State of the menstrual discharge. Now I'll explain in mind how it is applicable. Okay, with respect to the last name, more particularly the menstrual discharge. What is said with respect to the last name, more particularly, we should not neglect to ascertain if it recurs at too short intervals. Means what he says, if the menses appear at too short intervals or is delayed beyond the proper time, how many days it lasts, whether it flows in continuous or interrupted way, what is the general quality, how dark it is in its color, whether there is leukorrhea before its appearance or after its termination, but especially by what bodily or mental ailments. See, every time Dr. Hahnemann is stressed on, especially by bodily or mental ailments, what sensations? Again, sensation is mind. Again, sensation is minds and emotions and pains. So pain is again a sensation. Please remember, pain is not a particular symptom. Pains like burning or shooting or darting, this is sensation. Okay, and it pains. It is preceded, accompanied, or followed. So what is before, during, and after? If there is leukorrhea, what is the nature? What sensation attains its flow? Again, with leukorrhea, what sensation the patient feels? In what quantity it is? And what are the conditions and occasions under which it occurs? Again, Dr. Anand is saying on what conditions. So the modalities. So modalities is not necessarily aggravated by walking, aggravated by lying. No, modalities is the emotional modalities are also very important. Like I was telling the other day, I was talking about a cancer case with my colleagues and my sister and my child, or the doctors that we were discussing, our team. So they were treating a cancer case. I said, I want to know, if I want to relieve the pain of the person, I want to know the modalities of the pain. So modalities is not like aggravated by motion. Come on, if he's what? Inflammation is not get aggravated by motion. Aggravated by rest, he has to keep still. Okay, then you will reach Brahina. Brahina won't help. You have to understand the emotional modalities, whether the patient is abusive during pain, whether the patient is irritable during pain, whether the patient is sad during pain, whether he's feeling persecuted, whether he's feeling tormented by pain, whether he's feeling suicidal pain by pain. Then if by suicidal, if suicidal, then what I want to know, like how will he want to end his life? Like suicide, some people say कि ऐसा लगता है कि डॉक्टर साहब गला दबा दूं, ऐसा लगता है कि गला काट लूं, ऐसा लगता है नस काट लूं, ऐसा लगता है जहर पी लो, ऐसा लगता है कि खिड़की से कूद लूं, बहुत सी चीजें. सो ये मोडालिटीज है ना. So these are the things. Now, because I deal with minds, I want you all to understand, because every Dr. Herman himself has said, mind is supreme. है ना. So what is menstrual discharge? In fertility lecture, I have taught about this. What is menstrual discharge? Menstrual menses is, of course, the cry of the uterus for the ovum. Fine. There are times where the cycle is anovulatory. There is no ovum. So is the cry of the uterus. Many times we say that the uterus ruptures and it goes down, and then the ovaries are passed and the uterus is crying. That's okay. That is cool. There is no ovum. Not even PCOD. So anovulatory cycles are there. After a certain age, ovum is not produced. So ladies still bleeds. So what is the menses? And some people have menses very delayed. Some people get every 15 days. Some people get period will start, stop, start, stop, start, stop. Throughout the month they might bleed. What is it? I've taught. Come on. You all want to discuss? Hello? You can talk now. You can unmute yourself and speak. Hello? Hello? Doctors? किसी को बोलना है कि what is menses? Let us say what is bleeding from uterus. What does it do? Hello? Doctors? Hello? किसी को बात नहीं करनी है? अच्छा, मौन व्रत पर सब लोग. Yes, Geeta,
Yes.
tell me. Anupama, Geeta, tell me. Yeah.
Shedding of the endometrium when there is no conceptus, and in metaphysics it's considered as fruitless, and the female is not able to conceive.
Okay. Now it is like 4 days if you have menses. Okay. Usually for menses is 3 to 5 days, right? But if it continues for more time, where exactly is the menses affecting the body of the patient, affecting the life of the patient? Yes, please. Tell me. What part of the life is affected by menses? One, no conception. Other, yes, doctor.
The day-to-day routine is obviously hampered because the lady is totally confined to a place if there is heavy bleeding or cramps, and she feels restricted during travelings and irritated and mood fluctuations and lots of it could be hell, going through hell for some females who wouldn't like it at all.
See, what you told is the modalities again, irritability and all. Okay. But where exactly? I have seen females dancing during periods. I've seen females coming to me with lovely faces. They say, Doc, I'm looking cool. Whenever menses are there, मैं एकदम निखर जाती हूँ. Absolutely निखर जाती है. मेरे पास में कितनी महिलाएं आती है ऐसी. ये बोलती कि डॉक्टर साहब पीरियड्स आए तो मैं तो एकदम फ्रेश हो जाती हूँ, मेरी स्किन ग्लो करने लग जाती है। अपन भी कभी कभी बोलते हैं, अरे क्या बात है स्मिता, आज तो आप बहुत मतलब स्किन ग्लो कर रही है। हाँ सर, मेरा पीरियड आ गया। तो किस बात पर मेन इफेक्ट होता है? कौन सी बात पर मेन इफेक्ट होता है? फीमेल, कम ऑन, इट्स अ जेनिटल ऑर्गन, राइट?
During menses, a female is not available for intercourse.
Exactly, she is not available for the man. So the main thing where she is unavailable is for the mating. Okay. So if the lady is having protracted menses, that means she does not want to be available for the man. Sometimes I have seen females bleeding for 2 months, 3 months altogether. They don't want to. And sometimes I have seen females no periods for 2 months. You come, I mean, they come to you for infertility, give them medicines, and they don't get periods for 2 months at times. So desperately they want. Or so much they are in love with each other, or so much they enjoy each other's company. It's not only the intercourse part, but it is the company. It is the availability for the female to be with him. If she's bleeding, like very well said Dr. Anupama, I guess, who was that? She gets irritated and all, and she cannot go out. Like very well said that she is in trouble. पानी पूरी भी खाने के लिए नहीं जा सकती, हस्बैंड बोल रहा है लॉन्ग ड्राइव जाना है, पीरियड्स आ गए, तो फिर वही, तो हस्बैंड का वही होता है, जब देखो यार तेरा दुख रहा है, जब भी कहीं जाना है तेरे को पीरियड्स आ रहे हैं भी, मतलब उसको जाना नहीं है हस्बैंड के साथ में, शी डज नॉट गो विद हिम, शी डजंट एंजॉय द कंपनी, she doesn't enjoy the things that he's doing. It's that simple. So mainly she is not available for the man. Now आप लोग बोलोगे कि sir, what about unmarried girls, unmarried females? Now tell me, now the panga will be with father or with brother, abusive father to the mother. I'll tell you one case, simple case, ठीक है? चलो अपने अपने वाले फोटे में आते हैं. Cases. Father very abusive to the mother, mother also childish. Okay? Girl came to me with PCOD, with hirsutism, lot of complaints, all the blemishes and lot of complaints. Young girl, like around 11 standard में कितनी बोली थी? 16. Okay. Father very abusive to the mother. Father diabetic. Father religious man. एकदम मस्त वो अपना भजन कीर्तन करने वाला माशाल्लाह से. मेरे फादर की पहचान भजन की वजह से, क्योंकि मुझको भी भजन बहुत प्यार है, तो हम लोग एक ही जगह पे भजन कीर्तन करते थे, इसलिए मेरी फादर की पहचान है. तो देन ही सेड कि डॉक्टर साहब मेरे को बहुत ये है, शुगर है, मेरी बीवी को भी कर रही है, तो पहले मैं आपकी मेरी बीवी को भेजता, मैं क्या भेज दे बेटा. तो देन शी केम टू मी बिकॉज ऑफ दैट पहचान. डॉटर भी साथ में थी. द डॉटर केम, सॉरी नॉट द बीवी, डॉटर आई मदर के साथ में. तो यही था उसका इसकी बड़ी. मैं देखते ही बोला, क्योंकि बाल थे चेहरे पर, तो मेरे दिमाग में पहले आ गया कि यार इसकी भवें मिली हुई थी, बोला ये तो हिरसुट है, माइल्ड हिरसुट है. आई एम पास है, देखिए इसको पीसीओडी तुम मान लो. हाँ, आपको ऐसा पता चला मिला है तो बता बेटा, जो भी है. फिर भी मम्मी का था कि आप रिपोर्ट देख लो, ये देख लो. तो लड़की इरिटेट हो रही माँ से. लड़की बोल रही समझ गए ना डॉक्टर साहब, क्यों बता रहे रिपोर्ट सब उनको, तो देखते ही बता दिए कि मुझको क्या प्रॉब्लम है. मैं बोल दिया, मैंने टेस्ट 5 थी मेरा, आपने टेस्टोस्टेरोन किया होगा, टेस्टोस्टेरोन इसका ज्यादा है, इसको हिर्सुटिज्म है और इसको पीसीओडी है. सिंपल. तो शी वाज लाइक, बेटी को समझ गया, तो मैं मम्मी को डांट रही, मम्मी क्यों बोल रहे हो, उनको समझ गया ना सर, ये इनका ऐसे ही, मेरी मम्मी का ऐसे ही है, जिधर जाती है उधर ऐसे ही करती है सर. इतना क्या सर, ये काम वाली के साथ. फिर मम्मी बोलने लगी, हाँ सर इसको देखो, ये हमेशा मेरे पे चिक चिक करती है, ये करती है, कहीं भी कुछ भी बोलती है. तो फिर बोले सर बोलूंगी नहीं क्या, ये काम वालियों के पास में अपने घर की बातें बताना शुरू कर देती है, सब घर के वो टुकड़े लेकर बैठ जाती है. तो मैं तो जवाब नहीं दे पाता ना. अगेन मैं बोला कि फीमेल केस टेकिंग में अपना क्या एक ही फंडा रखना है, हाँ ना, तो फिर अपना ये रहता है कि फिर मैं बेटी को, फिर अपन अगर बोलेंगे कि ऑब्वियसली ये तो चिड़ेगी नहीं, आपने क्या बोलना है, बेटा समझदारी से ले चलता है, नेचर है सबका। दिस इज फीमेल केस टेकिंग, ये नुआंसेस आप ध्यान रखना। केसेस तो आपको सब पढ़ाएंगे, रेमेडीज आपको 50 गुरु पे पढ़ाने वाले माशाल्लाह से, है ना, लेकिन ये नुआंसेस को आप याद रखिए। ऐसे टाइम में आपने क्या बोलना है कि हाँ बेटा चल समझदारी से ले, जाने दे, ऐसी मम्मी है ना, होता है बेटा, मम्मी यहाँ ऐसी होती है, आप भी बड़ी हो जाओ तो शायद, नहीं सर मैं बड़ी होने के बाद ऐसे नहीं बनूंगी, केस टेकिंग चल रहा है, प्लीज रिमेम्बर, मेरा बेटा आप भी मम्मी बनने के बाद में ऐसी बन जाओगी, नहीं सर मैं ऐसी माँ नहीं बनूंगी, मैं तो अपने बच्चे को संस्कारी करूंगी, उनको फ्रीडम भी दूंगी, और ये सब कामोलियों के साथ में इनमें अपने घर के राज क्यों बताए सर, घर वाला आप कामोली कुछ है क्या, आप बताओ सर, आपके पास में दोस्त है, मैं बोलती हूँ मम्मी को कि मम्मी तेरे को फ्रेंड्स नहीं है क्या, मैं बोलती हूँ मम्मी को मम्मी तुझे दोस्त नहीं है क्या, उनसे बता ना, उनके पास बात कर, मेरे पास बात कर। तो फिर मम्मी बोलती इसके पास क्या बात करना, इसके बाप दिन भर चिल्ला चिल्ली करता, गाली गलौज करता, मैं इसको बताऊं। तो मैं बोला अब तो आपने बता दिया, पर मैंने बोला नहीं मम्मी को। फिर वो बेटी ही बोली कि देखो, या तो बता दिया कि बाप गाली देता है, और क्या लगता है सर आपको, मैं छोटी बच्ची हूँ, इनको लगता है मैं छोटी बच्ची हूँ, समझ में नहीं आता है सर, पहले समझ में आता है सर कि मेरा बाप कितना ये है, गाली देता है, सब देता है, भजन कीर्तन करता है, लेकिन इधर गाली देता है सर, लेकिन क्या करो सर, बाप है ना, अभी क्या है, चेंज नहीं कर सकते, बाप है सर, कोशिश करते हैं कि भगवान उनको दे और कम कर दे। तो फिर मैं उसकी मम्मी को बोला, मिला बेटा चलता है, कुछ रीजंस हो गए, आप लोग सॉर्ट आउट कर लो, बच्चों पर असर होता है, यही मैं बोलती हूँ सर इनको कि बच्चों पर असर हो रहा है, मम्मी को बोलती हूँ कि मम्मी आप समझदारी से लो, उनको अपने कुछ फ्रस्ट्रेशन हो गए सर, उनको उनके बिजनेस के फ्रस्ट्रेशन है, उनके भाई लोग अच्छे नहीं है, तो होता है सर, उनको शुगर है, अभी पतले हो गए, तो उनको उनके फ्रस्ट्रेशन है। मैं मम्मी को बोलती कि मम्मी आप समझदारी से लेते, ये तो है सर, सुनने को तैयार ही नहीं है। अब ये 11वीं की लड़की बोल रही है, आप सोचो 11th स्टैंडर्ड की लड़की, हार्डली 15 16 17 साल की बच्ची, हेलो, अब बोलो क्या रेमेडी है, चलो रेपोर्टी पे जाऊं, रुब्रिक से आप लोगों को बोलो, हेलो, देख पा रहे हैं आप, स्क्रीन दिख रही है, हेलो,
नो
हाँ,
Yes, sir.
No.
स्क्रीन शेयरिंग नहीं चल रहा है क्या,
नहीं।
अच्छा, अभी, हाँ बोलो, क्या रुब्रिक लेंगे, बोलो चलो,
Sensitive to morals.
सेंसिटिव टू मॉरल्स, कैसे, मम्मी को डांट रही है,
नहीं नहीं, घर की बातें बाहर नहीं बतानी चाहिए।
अच्छा, सिक्योरिटी क्यों लेंगे, कि जिधर जरूरत है उधर ही बताओ,
हाँ, वो उन्होंने कहा ना कि फ्रेंड्स नहीं है क्या, उनके पास भी बोल सकती है ना। यस।
लेक्चर है, हाँ हाँ हाँ, ओके, और और ओके, सेंसिटिव मॉरल्स, फाइन, गुड, पॉसिबल, व्हाट एल्स,
Sir, abusive father means elements from domination.
डोमिनेशन, व्हाई नॉट अब्यूज, सिंपल,
Okay, sir, abuse.
अरे ओके सर मतलब क्या है, किधर मतलब है? हम्म, और but father is abusive to the mother, इसको नहीं चल रहा है लेकिन ना वो, तभी तो इसको हो रहा है ना, ये देखो एक बात बताओ, why is she bleeding for the whole month, why she has hirsutism, she does not want to be a woman because she's seeing injustice being, I mean father treating the mother like this, hello,
Yes, sir.
father bhajan kirtan करने वाला still abusing to the mother, so she doesn't want the hypocrite father, right,
Yes, sir.
so the reason is the father, but still she's saying ki she's coping up with that by saying she's trying to pacify, मम्मी को बोल रही है कि होता है पापा के अपने अपने प्रॉब्लम्स हैं, उनके अपने फ्रस्ट्रेशन है, आप समझदारी से लो, क्योंकि ये खुद लड़की भी समझदार है। हेलो, ये खुद भी समझदार है, तब जाके ये मम्मी को बोले ना कि आप समझदारी से लो, कि फ्रस्ट्रेशन हो गया। तो सबसे मेन रूब्रिक आप लोग क्या, और क्या रूब्रिक आएगा बताओ, चलो बोलो। तो एलिमेंट्स फ्रॉम अब्यूज तो है पॉसिबल। वन मोर रूब्रिक दैट यू फॉरगॉट, चलो टेल मी, इज छोटेपन में बड़ी बात है, प्रिकॉसिटी।
Precocity.
ये समझो आप, एलिमेंट्स ऑफ अब्यूज तो है, बिकॉज उसी कारण तो बीमार पड़ी है। देखो, इग्निशिया, पल्स, स्टैप, नक्सोमिका, कौन है ये? हेलो, इनजस्टिस कांट सपोर्ट नहीं ले रहे हो क्या, कि आई एम नॉट गोइंग टू बी लाइक दिस, दैट इज व्हाई शी इज डेवलपिंग। हेलो, दैट इज व्हाई शी इज डेवलपिंग दैट masculine features. So she
Yes,
is
sir.
not available for anybody, any man. After, now tell me, Ignatius Stap, pulsarilla nux, which is the remedy that's possible here?
Can it be Nux vomica?
Hmm?
Nux vomica?
Ignitia.
Nexomica is possible, yes. What other? But intolerance
Ignitia.
ये वो नहीं ना, अभी भी ये pacify कर रही है ना, तुम समझो ना?
Staph aggressor.
Staphy's agria.
हाँ?
Staphy's agria.
Staph.
This is Ignatia.
Okay.
Because with father also she दिए है ना, क्या है, कंप्लेन कर रही बाप के बारे में?
नहीं।
हाँ, माइल्डनेस, बोलो, bear suffering, even outrage without complaining. इसका मेन जो था, वेरी गुड अंजलि, सेंसिटिव टू मॉरल्स, बिकॉज बाप है, समझ रहे हो, वो अपने फिजिक पे ले रही है। हेलो, ये अपने फिजिकल पे ले, लक्ष्मी का क्या करेगी? लक्ष्मी का माइंड पे लेगी ना, लक्ष्मी का कोई बिहेवियर डाइजेस्ट नहीं होगा, लक्ष्मी का सर दर्द होगा, लक्ष्मी का कोई इंडाइजेशन होगा। नाउ यू अंडरस्टैंड व्हाई लक्ष्मी का इज अ वेल नोन रेमेडी फॉर हेडेक एंड गैस्ट्रिक डिस्टर्बेंस, क्योंकि नक्स का हाजमा खराब होता है, नक्स को हजम नहीं होता है, intolerate करता है नक्स स्वामी का। That is why they develop acids and they develop all the ulcers and so much, मतलब इतना वो अंदर ले लेता है नक्स स्वामी को। समझ रहे हो? हेलो,
यस सर।
और स्टेफी सैगरे पहली मीटिंग में ये सब चीजें बोलेगी आपके पास में, मम्मी को डांटेगी?
नहीं।
हाँ, ये समझो ना तुम, इनजस्टिस कांट सपोर्ट है ना उसका, कि मम्मी तुम ये क्या कर रही हो, घर की बात बता रही हो, घर की बात बाहर बता रही हो, इसी पर से तुमको नक्स स्वामी का आना चाहिए सबसे पहले, पता है तुमको? अपने इग्निशिया आना चाहिए था। नक्स स्वामी का यस इसको लगेगा, कब लगेगा? जब ये इग्निशिया की स्टेट से निकलेगी, तब इसको नक्स लगेगा, तब नक्स लगेगा, क्योंकि ये लड़की को क्यों हिरसुटिज्म वगैरह डेवलप हुआ है, उसका वो जो एम्बिशन है कि मैं आई एम गोइंग टू बी अ बेटर फादर। हेलो, ये क्या है पता है इसका मेटाफिजिक्स, कि शी वांट्स टू बी अ बेटर मेल, कि आई एम गोइंग टू बी अ बेटर फीमेल एज वेल एज आई एम गोइंग टू बी अ बेटर मैन। ये इसका कॉन्फ्लिक्ट है। She wants to be a better woman and she wants to be a better man, both. She knows that it's a mismatch between father and mother. Now you tell me why the father must be so irritable and so abusive, diabetic and slim and religious. Tell me, people who are overtly religious are very much which minded? Hello, doctors. People who are too religious, too much into prayers, too much into bhajan kirtan, too much into dindi and pray, all that.
They feel they are guilty somewhere.
One, guilty of what?
Guilty of
Okay, something they have done.
yeah,
What,
something which is
what
there.
others? But he's a man who's been there. This man was there.
And maybe he's trying to suppress his sexual desire.
Exactly, that's what I'm telling.
Yes.
See, diabetic, slim trim, religious, and abusive to the mother. Come on, impotent. Because wife is not able to arouse him. Hello. So he's become unhappy with his life. So the girl has understood this thing that he's not happy. That is why she's trying to balance the conflict of her and her to try to be a better human being. This is Ignatia. This conflict Ignatia has. She wants to be a better man. She wants to be a better woman, both. Trying to balance both. Though it's not there in harmony desire. Because here it's a want. In Ignatia, it's a want. Ignatia is what? Hello. Ignatia is made of what? Ignatia is what actually? Ignatia is what? Hello. It's the goddess of
Plant.
right?
Holy
Huh?
flower,
Huh? But it's a
Plant.
holy
but it's a
plant.
yeah, but what is the word ignite? Ignatius, how it has come? The god of fire,
Fire.
purification. What does fire do? Fire purifies. Fire is a purifier. Hello. Understood?
Yes, sir.
Why
Yes,
the
sir.
name Ignatia? Understood now? Okay. Now coming back to the. Now you understood why the unmarried girls has this thing.
Menorrhagia.
Says Profis menses. Now, if the girl is coming with leukorrhea, tell me, leukorrhea is what? Desire, more physical desire. So if I ask if there is itching also with the leukorrhea. So if there is itching with the leukorrhea, that means what? It's too much. They want it desperately because it comes to skin, right? Hello. When it comes
Yes.
to itching, that means it is there. See, just imagine a woman scratching her genitalia. It's what? It's just like masturbation. So much she has desire. Now, again, unmarried girls, if they have it, so it's not necessarily that physical sex part. It is a burning desire for organism. So, organism is not necessarily always with the man and woman mating. It's not only achieved by mating. There are so many things. That is why in spiritual world, क्या कहते हैं हिंदी में संत समागम है ना spiritual intercourse spiritual discourse क्या कहते हैं उसको intercourse and then you feel that orgasmic you feel orgasmic by singing you feel orgasmic by driving the bike very fast you feel orgasmic by bungee jumping you feel orgasmic by trekking by singing by making by painting by drawing by taking lectures it's orgasmic. So the girl has some passion. She wants to have that feeling. Now you have to differentiate this from the kick, okay? From the kick that we get from Sutta and all that stuff. Okay? Now the modalities that you have to take. What Dr. Hanuman has said, what sensation attends the flow, what quantity, again the quantity, if it is really very dark, if it is stinking, that means the man stinks to her. Hello? If it is dark black, that means she is suffering because of it. It is destroying. When the blood comes to be dark black, that means what? It is destructive. Destruction is happening there. Hello. Are you getting me, guys?
Yes, sir. Yes, sir.
Yes,
Am
Yes.
I able to give you food for thought? Yeah. And the under which occasions? Please remember this. What occasions? Okay. So these occasions you have to understand. Now so the footnote, what it says, basically pregnancy, sterility, sexual desire, miscarriages, suckling, state of menstrual discharge, and leukorrhea. Okay, you can take the screenshot of this. Now moving to next. What is more important in here? This is, see what the Hanuman said, chronic disease, the investigation of the signs of the disease above mentioned and of all others must be pursued as carefully and circumstantially as possible, and the most minute peculiarities. What is saying? Most minute peculiarities must be attended to, partly because in these diseases they are the most characteristic. So the minute things are more characteristic and at least resembles to those of acute disease. If a cure is to be affected, they cannot be too accurately noted. Partly because the patients become so used to their long sufferings. Please remember, the patient becomes so used to their long sufferings and they pay little or no heed to the lesser accessory symptoms. Lesser accessory symptoms, which are often very pregnant with meanings. तो मैं हमेशा एक चीज बताता हूँ, याद है ना मेरा क्या एक शेयर होता है कि माना कि केस क्या है, इश्क में थोड़ी कमी नहीं होगी, मगर इश्क में थोड़ी कमी भी थोड़ी नहीं होती है. मैं बोलता हूँ ना कि केस टेकिंग में थोड़ी कमी रह गई, मगर केस टेकिंग में थोड़ी कमी भी थोड़ी नहीं होती है. So what is he saying here? A master often very useful in determining the choice of the remedy and regards them almost as necessary part of their condition, almost as health. So कुछ चीजें बोलते नहीं कि अब क्या करें सर, हस्बैंड का नेचर ऐसा है, अब वो आदत पड़ गई है. आदत पड़ना अलग है, बट वो है, उसको इस बात की तकलीफ हो रही है. लोग बोलते नहीं नहीं सर, मैंने अभी इसका नेचर एक्सेप्ट कर लिया, ये ऐसा ही है. नहीं, एक्सेप्ट करना तुमने सिर्फ एक्सेप्ट किया है, बट उसका जो रिपरकशंस आप पे होना है वो होना ही है. जैसे अगरचे आपके यहाँ पे थोड़ा सा भूख, जैसे आपके घर के बगल में अगर ट्रेन जाती है, फॉर एग्जाम्पल एक कोई मूवी देख रहा था मैं, उसके ऐसा था कि वो ट्रेन जाती थी, उसका घर थर 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 होता था. एक्सेप्ट कर लिया था उन्होंने कि अपने घर के बगल से ट्रेन जाती है और जब भी जाएंगी तो थर 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 होना है. लेकिन आपने एक्सेप्ट कर लिया, लेकिन जो थर थर हो रहा है, जो बर्तन गिर रहे हैं, जो हो रहा है, वो तो हो रहा है ना. दैट तो ये टेकिंग आपके घर की लाइफ तो कम हो चुकी है ना. हेलो, बट ड्यू टू द वाइब्रेशंस, दो इंटरमिटेंट, दो इनफ्रीक्वेंट, but it is affecting the life of the house the same way it is going to affect the life of the patient. So things they accept also, then you should ask what's the reaction of the patient to that. फिर वो बोलते कि सर क्या करें, अभी सास से कुछ कर नहीं सकते, बट सर बार बार बोलती रहती है सर, टोकती रहती है सर. अच्छा, वो कुछ प्यार से टोकती है ऐसा नहीं है सर, मतलब वो एकदम माइल्डली बोलती कि छिड़के नहीं बोलती, लेकिन टोकती है ना सर, टोक रही है. एक्सेप्ट तो कर लिया है, टोकना. सो व्हाट इज द सिम्टम, व्हाट इज द रूब्रिक फॉर दिस? बार बार टोक रही है सर. हेलो,
Nagging.
nagging. So what is rubric, my dear? What is the ailment? Where is it affecting her? Where is the
Admonition.
reason? Huh?
Admonition.
Okay, rebuke. But admonition is a slight rebuke. Okay, ailment from admonition. Okay, और admonition में लेकिन ये क्या बोल रही है कि माइल्डली बोल रही है सर, ऐसा नहीं है, लेकिन बोल रही है ना सर. Okay, admonition. What else? अरे टोक रही है, बड़े प्यार से टोके. हाँ,
criticism.
this is sensitive to criticism. क्या रेमेडी है?
Carcinosis.
Constant nagging, carcinosis. Understood? भले एक्सेप्ट किया है, लेकिन तकलीफ तो उसकी होनी है ना ब्रो. समझा?
यस सर.
तो ये इसको आप क्या करते हो, ऑलमोस्ट एज हेल्थ ले लेते हो, बट हेल्थ नहीं हो. सो द रियल फीलिंग विच दे हैव well nigh forgotten in the sometimes 15 or 20 years of suffering, they can scarcely bring themselves to believe that these accessory symptoms, these greater or lesser deviations from the healthy state can have any connections with the principal malady. लोग बोलते हैं नहीं, अब मेरा हस्बैंड ऐसा सर एक्सेप्ट कर लिया, उनका नेचर ऐसा है, उनके लिए जल्दी उठना पड़ता है, उनको खाना बनाना पड़ता है, ये है, लेकिन है, तकलीफ है ब्रो, तकलीफ है. I had a, I won't tell about the case. It is a little, the year, I think this hypochondriasis and all, I would take in the next lecture. I think you all, I would want you all to really, one more lecture I'll take. about female case taking. It's a vast topic, and majority of the patients are in the usual practice are females and children. Males are like 20% of the total practice. At least I have. Okay, 80% is like the children and females. Okay, so I would like to devote one more lecture to this. Any questions till now, or shall we wind up the lecture? Mansi? Mansi, the moderator,
Yes, sir.
tell me. I think we should finish up because this was a very important thing I wanted you all to understand. Next lecture, I'll talk about sterility and all that stuff, inshallah. And how to differentiate between hypochondriasis and exaggerating and feigning. That's very important. What Dr. Hahnemann says, ki sometimes because they want to be cured, they want more attention, so they would appear as if hypochondriacs. Because in females, usually allopaths name it as HYS. They give alprazolam and whatnot. You know, we are not going to do that. I believe in the patient first, and then I judge them and call them hypochondriacs or hysterical. They're in pain here. Who wants to be sick? Come on, it's only 1% people who want to be. Not even 1%. How many tarantulas? I mean, I have treated almost like 1,70,000-80,000 still date. I haven't prescribed tarantula 1,000 times in my life. It's not even 1% of we have. Valerina also not 1,000 cases I have seen. Sabadilla also not. So very less percentage of it. Nobody wants to be sick. They all are in pain. They all are in pain. They all are in pain. The pain can be physical, the pain can be emotional. So they come to you with pain. So I would really want to devote one more lecture on that, if you allow. Moderator, Dr. Mansi.
Yes, sir.
Okay. So let us wind up, beta. Thank you very much. Thank you very much. Yeah.
Thank you.
Thank you,
Thank
sir.
you so much, sir, for one more insightful lecture. And we
Then
are
ask the questions
understanding
in
the
our YouTube channel. You can go
YouTube.
and write the questions there. Please do write whatever whether you like it, what point you liked it, what point you did not like, anything. Please do go to the YouTube, see the lecture again, give your opinion, and don't just send hearts or thumbs ups. Please write. Okay, I want to know what you all feel so that I can improvise. See, I have devoted my life to homeopathy and family, and you all know nothing else. Okay, and to ghazals a little bit to my art. But majority of it is homeopathy and my family. And you are also my family. So please do comment and बिंदास लिखो, कुछ नहीं होता है, जो भी लिखना है. Okay, YouTube पे जाके. Yeah. Yes, Mansi.
Yes, sir. Thank you, sir. We are understanding the practical part of organon through your lectures. So thank you so much. And we are waiting for the next remaining lectures, and other parts of organon also will be covered in this series of applied organon. So thank you.
We are going to cover the
And
whole organ, don't worry. We are going to
yeah,
make it very simplified for you all, inshallah. Okay.
thank you.
Thank you.
Thank you, sir. Thank
Bye.
you,
God
my
bless.
team PHF, and thank you everyone for joining.
Thank you.
Thank you.
God bless.